Welcome to the Nurse Shark Academy Show, a Baxter Professional Services production. Welcome to the Nurse Shark Academy Show, where we're experts in nursing and experts in business. I'm Tina Baxter, your host. Our mission at the Nurse Shark Academy is to expand the consciousness of nurses as experts, to reflect their individual and collective power by promoting self-agency through inspiring nurses to dream big, reach far, and soar to new heights in business and the profession of nursing, thereby producing a healthier and richer society. The Nurse Shark Academy Show highlights nurse business owners and others in the healthcare field who promote entrepreneurship. We interview nurse leaders and encourage them to tell their story. Today's guest is Christine Dorman, and our episode is How One Nurse with a Passion for Education Uses Her Skills as a Legal Nurse Consultant. Welcome to the show, Christine. Hello and welcome to the Nurse Shark Academy Show. I'm Tina Baxter and I'm your host. We're the Nurse Shark Academy, where we're experts in nursing and experts in business. Our mission at the Nurse Shark Academy is to expand the consciousness of nurses as experts, to reflect their individual and collective power by promoting self-agency through inspiring nurses to dream big, reach far, and soar to new heights in business and the profession of nursing, thereby producing a healthier and richer society. The Nurse Shark Academy Show highlights nurse business owners and others in the healthcare field who promote entrepreneurship. We interview nurse leaders and encourage them to tell their story. Today's episode, we have Christine Dorman, who is joining us. She is the owner of Vantage Legal Nurse Consulting in Coral Springs, Florida. Welcome to the show, Christine.
Thank you, Tina. Thank you very much for having me.
Thank you. Now, as I said, the first question I usually ask our guests is, what made you become a nurse? How did you get into nursing?
Nursing, actually, that's a pretty good story. Nursing actually was not my first calling. I actually wanted to be a dancer. And when I went to ballet school as well as jazz school, I had a dance instructor that told me that I would not amount to, or wouldn't make it on Broadway. Let's just put it that way. And this was in high school. So I needed to kind of reevaluate what I was going to do as far as making a career move. And in sitting down and speaking with my mother, she actually brought up the idea of nursing because she felt as though when members in the family and within our family members got sick, I kind of gravitated towards trying to help them feel better. I would do little things such as, oh, do I need to get you some tea? I'll go and get your Tylenol for you. I would go and try to do the little things that would try to get them over the hump and try to see if I could, quote unquote, nurse them back to health. So she made me realize that was a natural calling for me. So that is what led me to start to consider nursing as a profession from that standpoint.
Well, first of all, I'm going to say boo to that person in high school.
And I'm a very good dancer, by the way. I want you to know that.
I don't doubt it. And I just think that sometimes people don't recognize what we have to offer. And my first thought was, well, you've got your college career to go to study dancing. In my mind, I'm thinking, why weren't you studying and going to Juilliard or someplace like that?
For sure.
Yeah. I'm like, so maybe you won't dance on Broadway, but maybe you'll dance other places. You never know.
Yes. I dance in the comforts of my own home now in front of family and stuff. So,
well, you can have a second career or a third career now, dancing on TikTok if you so choose.
No, that's not me.
So when you started your nursing journey, where did you go to school?
So I started out as an LPN, a licensed practical nurse, and studied for about a year there locally. And I had the privilege of meeting with at the time it was the community college nursing dean of nursing at the time. She would make multiple visits to the vocational program where we were and encourage us not to stop there, that this was not this was just the beginning of our nursing journey. So I took her up on that offer and transitioned and transferred over when I completed my studies to the associate's program, Associate of Science Nursing program here. At, at the time, it was Broward College. I think it's Broward University now. And completed my associate degree in nursing and earned that, my 2 year degree. And from there, I went on to obtain my bachelor's of science degree in nursing at Florida International University. Completed that and decided I was going to continue. And during this time, I was still working as a nurse while I was going to school. So I would work in the evening shift, the 3 to 11 shift. They don't have that anymore. That was my jam, that shift.
Mhm.
So
I
I
was a
felt
second
like,
shifter too.
yeah, I felt like I got a lot done. Like I was able to not only continue my studies and but I was able to see family, have a little workout routine, study, meet up with friends, and still be able to work the 3 to 11 shift. And it was a refreshing time at that point. So went on, completed my bachelor's in the meantime, worked for a little bit as a bachelor's nurse on med surge, telemetry, and oncology, and from that standpoint. And at that time, I decided I was dabbling with what the nurse practitioners were going to do, what they did, and was a little bit curious about how do you get into becoming a nurse practitioner. And without really kind of thinking about it, I just kind of went head first into it, not knowing where I would end up or if I wanted to, work in an office setting or continue working, in the hospital setting. So eventually I had transitioned to the intensive care unit at that time and continued to go on but just taking classes one day at a time and kind of 1 month at a time until I kind of tried to figure it out. But eventually enrolled in a nurse practitioner program, and I actually ended up in the first acute care nurse practitioner program that was started here in Florida, down in Miami Shores. So we were the first graduates in 2005, I believe. 2005, yes. And completed my master's degree of science, master's in nursing there, and became an acute care nurse practitioner at that time.
And so during that time, you also continued to work at the ICU.
Mm-hmm.
Okay.
Yes. And decided, I said, oh, okay, ICU is a natural fit for me. I wonder, are there any nurse practitioners that work in the intensive care unit? And at the time, for us in Florida, there were very little. We didn't see a lot of the nurse practitioners in the inpatient setting. They were mainly kind of relegated to the primary care setting. And if they did come in, you know, the way how the healthcare was set up at that time is you kind of came in, you rounded, you went to the office, you pretty much took care of patients in the office. But there was no like definitive role where, at the time where when I graduated in my area for us to be hospital based. But that eventually changed because I was hired as one of the first nurse practitioners for our pulmonary group and worked for them for about 12 years. And I was one of the first nurse practitioners in the hospital where I worked at the time, and was hired by, our private practice, our pulmonary physicians at that time. So I kind of felt like I was a trendsetter at that, if you want to call it that. But
Definitely.
yeah,
Definitely
so
a trailblazer.
yeah, so didn't realize what I was doing initially, but looking back, you take all of that, and you kind of have to give myself a lot of credit for that, because they were the ones that took me under their wings. They taught me what to do in the role as to how to become a provider, while I still had to try to stay within my scope and try
Hmm.
to learn, as well as trying to make sure that I was also setting a good standard and a good pattern for those that were kind of coming behind me and working beside me. So that in itself, it was a lot of it taught me a lot about growing not only in the profession as a nurse practitioner, but also leadership wise. I had to develop those skills, I would say, pretty much as on the job training. So, and I was fortunate enough that I went to school with one of my other coworkers, but we did not work in the same facility after we graduated, but we would bounce things off of each other after hours per se, and on the weekends to kind of figure out, hey, what was your day like today? What did you go through? Were there any challenges within this, with your patients or with, you know, your peers or who you were working with. So we kept tabs on each other that way. And only to find that we had nurses that were working at the bedside that would come up to us and ask us, well, how do you go about doing that? How do you go about becoming a nurse practitioner? What should I do? How do I get started? Where do you think that I will end up working? We want to do what you do, but you had to kind of break it down and kind of peel that layer of the onion, or peel it one layer at a time, and let them know, hey, it's going to take some hard work, some dedication. Your experience and your skill set would definitely carry you, but don't just kind of just look at me in passing and think that that's all that there is to it. There's a lot more to it than meets the eye.
Definitely, there's a lot to unpack there. And one of
Mm-hmm.
the things that you talked about was that need for community. Even after you graduated, it was great that you
Yes.
had a colleague that you can call and ask
Mm-hmm.
questions of and just share your frustrations about the day. I remember being a brand new
Mm-hmm.
NP and wanting to have that conversation with people. And it's kind of the same with being a brand new business owner. You need
Yes.
that community around you, and that's
Mm-hmm.
what we try to foster in the Nurse Shark Academy, is that community, so that you're in business but not in business by yourself. You have people to bounce ideas off of and to
Mm-hmm.
learn and grow with.
Yes, exactly. And I definitely agree with that because having started my business, and it's been a little over a year now, it's almost on the job training again, then again reaching out to people who are experienced and those who are inexperienced, or the novices per se, starting with at the same time you did. But you just continue to ask questions, and that is how we all grow. And the light bulb comes on every once in a while, and you're like, oh my gosh, this is what they were talking about. But even the big thing that I learned in the beginning with starting the business was listening, because I that was such a that's been such a benefit, is to listen, to figure out, to hear what other people have heard, their stories, and you find a lot of commonalities within their stories.
You definitely do. And what I like is that idea of working together.
Mm-hmm.
And
Yes.
you know, when you start a new endeavor, and I want our listeners to understand that if you're launching a business, you're starting a business, or going back to school to become a nurse practitioner, or anything that's new, you start at the bottom again. So you
Yes.
have all this experience, but you don't go all the way to the very bottom. You
Yes.
build. And so, but you go back to that novice until you become that expert. And that's okay. That's part of the
Yes.
process. So I want you to be able to cut yourself some slack, um,
Yes.
and not look at you and me and say, "Oh, I want to be just like that," because you don't
Yeah.
know what happened in the backstory to bring us to this point. Which is why I like having these conversations, is so they can understand how we got to where we are, and
Right.
so they'll know that it's just taking one step at a time and keep going and keep going and keep going.
Exactly. And how often, I'm not sure if you've ever asked yourself this question, is with regards as it relates to nursing, you're just the learning the business side is completely different than when we were at the clinical side. And in school, I don't recall being taught that much, having business courses. And I wish like more, nurses, as well as, you know, anyone that's within nursing is more exposed to the business aspect of things, because I think that we are so vast with our skill set. There's so many of us that are so creative, and more so than others that maybe have not tapped into go having a business course. But I just feel like those are beneficial to just try to help us get a better foundation as to try to grow as a business owner.
It's so important to have those foundational pieces in place when you're
Mhm.
a business owner, because I've seen the train wrecks where you started a business and then you found out that wasn't the way to go, and now you have to
Yes.
tear it all apart again and try to build it back up, and
Yes.
you're wasting time and you're frustrated. And that happened with a business that I was associated with. They
Mhm.
started a allergy testing business, and I was the nurse practitioner for them. And they were in beta testing, and I was part of all of that with them. But they had to stop because they had hit some regulatory hurdles,
Yes.
and the lawyer that they were working with unfortunately didn't give them the correct advice, because they didn't have a lawyer that was specifically in that area. And
Wow.
so this is a case where if anybody's listening and you're thinking you're
Mhm.
needing an attorney, make sure you choose the right attorney. You wouldn't go to your endocrinologist, your diabetes doctor, and talk to your diabetes doctor about your cancer or ask them for
Exactly.
your surgery. And so you wouldn't do that with an attorney either. So those are lessons learned and starting
Absolutely.
a business. So it's very important to have those foundational pieces. So how did you transition then into starting your own business?
The business bug hit me when I decided to go back to seek my doctorate, and I think also too with everything that transpired within the pandemic, it was like doing this for such a long time now. I was like, do I have more to give? Am I giving enough? I feel like I can that my skill set is so sharp now that I feel like there's more for me to give back to. And it's the old cliche thing, I like legal stuff. I watch the Law and Order shows. I watch all of those shows, and I was like, hey, I could figure that out. How do I take a deeper? How do I blend both of the two? How can I bridge them? And in being at the bedside, I always found that I tried to always find the pieces of the puzzle that would help me solidify how to that diagnosis of the patient, or what transpired to lead me to that diagnosis, like what pieces were missing. So I felt that that was a natural calling to see how can I translate my skill set, my knowledge base, the quality improvement aspect as well from the clinical side and the patient safety side to see how I can, bring that into business. So I felt that it was important. I was like, okay, I like the law, I like medicine and nursing. I know more about medicine and nursing. I know very little about the law, but how can I blend the two? And naturally, it was very scary trying to talk to attorneys the first time. But once they realize like what we bring to the table and what we offer and how much we can help them and help the clients that they have that are looking to see, hey, this happened to me in the hospital. Do you think that, what do you think about that? So you try to help them understand or educate them rather on the medical and the nursing aspect of things. So I educate from not just the clinical side from the nurse practitioner standpoint, but also like from the registered nurses side.
So, and you're still a practicing clinician like I am as well. So you're still
Yeah.
seeing patients. And so, have you worked as an expert?
Actually, I just started working as an expert, and I actually stepped away from the bedside just temporarily. So I'm actually more on the academic side now. No, I'm actually teaching the acute care nurse practitioner students. So staying current with that, with guidelines, keeping up with guidelines, and reading through things that I hadn't read over in a long time, and tying it back to my work experience, my clinical work experience. All of that I feel is complementary to helping me be a better, you know, provide academic from an academic standpoint, from a nurse practitioner standpoint, and also an expert standpoint. So I was recently asked to take on some expert cases, and I'm looking forward to seeing how I can help out with that.
That's great. So you're now in academia.
Yes, started teaching I think back in November of 2022.
Okay. Well,
Yeah,
congratulations. And so
thank
are
you.
you still pursuing your doctorate during this time or?
The Actually, my doctorate, I completed that. I graduated in 2021 from the University of Pittsburgh. I completed their online doctorate program in health executive systems leadership, which was a rigorous program. We did a lot of patient safety uh, things with systems involved and how we can improve as nurse leaders. And that program actually gave me the inspiration as far as being innovative, and that is when I started thinking about becoming a nurse business owner. As what can I do, what exactly can I bring to the table as far as being a little bit more autonomous or independent with my thinking, and offering assistance that way.
And so are you engaged in any research projects currently, as part of your academic work?
Not currently, but I've been asked to be. So what I'm looking at now is like trying to figure out with what's happening with artificial intelligence. That's the big buzz kind of right
Yes.
now with
Yes.
our students, and not just so much with the students, but then in retrospect, we look at how a lot of the tools that we use at bedside from the past, we look at trends in nursing and in medicine. So we've kind of been using some semblance of artificial intelligence from that standpoint to kind of help with how we collect data on patients. But now we just want to make sure that we're doing it in an ethical and compassionate and standard. So we're talking and having integrity as well with it. So we've been kind of talking about that amongst ourselves as faculty members, but even as legal nurse consultants, we are also discussing that as well. And from to how do you make sure that you're going to still be relevant when you have artificial intelligence that's kind of come into play now. So
Well, the thing about artificial intelligence, at least so far, right now,
mhm,
it is not as sophisticated enough to see the nuances.
for sure.
Having participated in some AI generated articles,
Hmm.
uh, I noticed that sometimes they don't. The specifics, the flavor, the cadence is a bit stilted still.
Hmm.
And so it's very generic. And so that human element is always going to be important. Even if we get to the
Absolutely.
Star Trek days and we have tricorders and transporters, and, Chief
Hmm.
O'Brien still had to push the button, right?
That's right. Yes. You still have to input the data to generate feedback, right?
Exactly.
Yes.
Exactly. Yes. Okay. And so you said you've been in business for about a year.
Yes.
So, what's been some of the biggest challenges for you as a new business owner?
The biggest challenge, it's like I've started as from an independent side. So I know that there are some consultants that I've run into that work in-house, and they feel like they have a little bit more stability from that standpoint, with being able to go to someone if they have a question that can be answered right away. The challenge is trying to navigate or go into a space that kind of is foreign to me as the new legal nurse consultant, and knowing where to go to get to build a community. So that was where I started first, was who do I reach out to? Um, Finding a business coach, finding another legal nurse consultant that may be close by. That is not. I don't have another legal nurse consultant that's close by. So I found my joining organizations such as the AALNC, and I've met you through other business coaching endeavors. I'm not sure. Am I allowed to say?
Sure.
Okay. Shout out to Lori Brown. And
Yes, yes,
yeah,
our
yeah.
coach.
So
Yes.
okay, shout out to her and you know, her empowerment with for nurses, that she's a big advocate for that, and signed up with her program, learned a lot there, and just continuing to grow with Pat Iyer and
Yes.
meeting like great people who are who've been walking and living and breathing this, and just learning from learning from their wisdom and their experience as well, and then also being encouraged by the community that you've come into, because it's such a small community and everyone is very, what I've encountered is that they're very protective of the space that we're in. So, and encouraging us to continue to join other organizations such as the AALNC, and attending conferences and getting into workshops, and being encouraged to kind of get out of your own way per se, because sometimes we can be our own worst enemy, because we've not been taught as nurses to be able to get that elevator speech. How do you get it ready?
Yes.
This is where I found that, you know, tapping into the networks and to other like-minded individuals has helped me to kind of feel a little bit more comfortable to go out and be able to put myself out there, not just as the nurse, but as the business owner itself, and then gaining the confidence to kind of untie the rope from the ship to leave and go into uncharted waters, and learning from that aspect. So, going to conferences, kind of settling into where the attorneys are that you want to help assist with their clients. Going to their conferences, joining LinkedIn and tapping in, and just listening to other nurses, as well as engaging with people in my local community. I joined my Chamber of Commerce. They've been immensely helpful here for me as well. And even just not just legal nurse consultants, but like I said, joining the Chamber of Commerce, I've met people from the business community that had no idea that nurses could do what we do.
Yes, which is one of the reasons why I
Yeah,
have the show, so that
yeah,
other nurses can hear about it, but other
yeah.
people as well. And I want to again, we mentioned two very big coaches in the
Mhm.
legal nurse consulting space. And what I love about working with a coach is that, sometimes it's things that you know that you should be
Mhm.
doing, but you've forgotten. And
Yes,
sometimes it's things that you don't know what you don't know,
yes,
and it's enlightening to get that information. And so I encourage you to our listeners to find a business coach that works for you, that is someone that you resonate with in their style of teaching. Not
exactly.
everyone teaches the same way. I've been in Pat's program and I've been in Lori's program, and I can tell you their
Yes,
styles are completely different,
for sure. Yes.
and that's okay.
Yeah. But
And
look at all the knowledge that they both possess, and you gain, and you meet other legal nurse consultants. And what I ended up get gathering from being a part of that is you have other legal nurse consultants that trust you enough to say, "Hey, can you help me with a case?" And I
yes,
started getting, my first cases from other legal nurse consultants that recommended you, that wanted you to subcontract, and they recommend you to the other attorneys from that standpoint. So, I think that that's something to be said. When you build your community, you're not just kind of building or the support that you garner from that, but you're also that solid reputation and the business acumen that you gain from all of that. It's priceless. So
exactly. And like I said, when you're entering a program, Lori's, Pat's, mine, find
Mhm.
what you need and get into the community and be active in the community. And that's key, is to be active in what you're doing. And, you can be the person that takes all the classes, but if you never actually put it into action, you're not
Right.
going to get anywhere. And that's the most important thing. Be an action taker.
For sure. And then also, too, I think we should point out that we all have different skill sets. You know, some of
Yes.
us are great with cardiology. Some of us are great with, being an emergency room nurse. And
Hmm.
we have, our nurses that have like a great orthopedic and med surge background. We have nurses that we meet that they could speak to what's happening neurologically from that standpoint. And that is their strong skill set. If that is where you find that your niche is, then work on that and develop that. Develop the strength, but also while you're developing that strength, while you know that you have that strength, I found that I've been trying to work on my weaknesses as well to try to bring that up to par. So, and that is in itself is was challenging. It was just like, oh, I'm weak at that, but I don't focus so much on my weaknesses anymore. And initially I was kind of fixated on that, but if you do that, you're going to kind of bury yourself at the end of the day. You
Yes.
want to kind of always try to keep a positive mindset and to always make sure that, hey, if you had a bad day yesterday, that's not necessarily what's going to happen to you the next day. You have to just release what that doesn't serve you anymore. Release it and try to, put one foot in front of the other and just keep it moving.
I so agree that mindset is key and
Mhm.
critical. And this morning I started the day and I was thinking, I got out my car and I said, okay, it's a brand new day, new opportunities. That's what I told myself. I
Yes,
do my affirmations. If you're on my other show, you'll hear that on the Nursing News You Can Use show. You'll
yes.
hear our daily affirmations. I always start off with 3 affirmations. And I thought, okay, I'm going to make today the best day and go in there ready to rock and roll because it's an opportunity. Every day is an opportunity. So if you had if someone wanted to talk to you more or get more information, how would they get in contact with you?
I am on LinkedIn, Christine Dorman, and they can also contact me through my website, Vantage Point Legal Nurse Consulting. And I believe the phone number is attached there as well, 800 368 7410. That's 800 368 7410. Or they can email me at Christine Dorman at V for Vantage, P for Point, L for Legal, N for Nurse, C for Consulting.com. So,
That's vplnc.com.
yes.
Okay. All right, thank you. And so I do see that you have, if there's any attorneys who happen to pick up this website or LNCs that need assistance, she's available for that as well. And I want to thank you for your time. And so, if you had one piece of advice for our listeners for a brand new entrepreneur, what would it be?
Just do it. I'm going to steal Nike's slogan. Please don't sue me for plagiarizing, but just do it.
Just do it. There you have it.
Just
Get
do
out
it.
there,
Get
take that
out there
initial
because
step.
yeah, you don't want to have regrets, and also you also know that you are a lot stronger and more so than you know. So you have, and for nurses in particular, that we have such a vast skill set that we bring to the table, a lot of dynamic things that we could share, not just with our nursing community, but with the business community as well. And go from there. So that is my recommendation is to just get out there, be vulnerable. With Allow yourself to be vulnerable, I should say, because you never know what you can make lemonade out of lemons with your own self here.
There you have it. I want
Yeah.
to thank you for your time, Dr. Christine Dorman,
Oh,
for
thank
joining
you.
us today. And this is the Nurse Shark Academy. Don't forget to like and subscribe to our YouTube channel. Don't forget to hit that notification button so that you're notified when our new episodes come up. And also follow us on Podbean and Spotify, Apple, wherever you get your podcasts. You can download our podcast. I want to thank you again, Dr. Dorman, for your time. And thank you for tuning in to the Nurse Shark Academy show. I'm Tina
Thank,
Baxter.
thank you so much. It was a pleasure.
Thank you. Thank you for listening to the Nurse Shark Academy show wherever you get your podcasts or watching us on YouTube. Don't forget to like and subscribe, and don't forget to hit the notification bell so that you'll know when all of our episodes come out. If you want further information, you can contact us on the Nurse Shark Academy.biz.